This is Dr. Ami, your friendly rheumatologist. And today we're talking about back pain. So, back pain is very common, and the most important question that I am being asked is, when should I see a rheumatologist? Of course, if you cannot see all of the back pain as a rheumatologist, and the truth is that the primary care physician, usually they don't actually refer to rheumatology. And that sometimes can be an issue because if you have an inflammatory back pain, you actually want to be seen by a rheumatologist. So today we are going to go and deep dive into the different type of pain that causes back pain and when you need to ask your rheumatologist. It's going to be a very short and sweet episode. So the first thing is to realize that there are two types of pain. When you're talking to a rheumatologist, we're really differentiating the mechanical pain and the inflammatory pain. Mechanical is basically when the pain is caused by overuse, when it's caused by muscle tension, if you've done some exercise, or if you are someone that repeatedly has trauma. So for example, someone that's doing construction working or using their hands a lot or their back a lot, that will be what we call mechanical back pain. And the other type of pain is inflammatory. Mechanical is annoying and it can be really painful, but it is not necessarily dangerous in the sense that it doesn't cause inflammation in your body. And it's not because you have mechanical back pain that you can have heart failure, heart issues, or vessel issues, or eye issues, and so on, or skin issues. And so as a rheumatologist, our job is to really look what if there is any sort of inflammatory reason for this back pain. So there are three main questions that you want to ask yourself to see if you should be seen by a rheumatologist. Number one, is the pain worse in the morning? Is it the first thing that you complain of when you wake up? So you wake up, most of the people that have mechanical back pain will have no pain when they don't do anything. And so it's when they are moving that it can cause pain, but it's not, the worst pain is not in the morning. The worst pain is at the end of the day. Okay, so the first question is, when is the back pain the worst? If it is in the morning, then that is a possibility that this is inflammatory. The second question is, do you have morning stiffness? I didn't say sickness, I said stiffness. Are you feeling stiff in the morning? And the way I explain it to my patients is, do you have to do this in the morning? Do you have to turn your back until it feels a little bit more comfortable? And is this ongoing for more than 30 minutes? So do you have morning stiffness that's more than 30 minutes to 60 minutes? I have some patients that can go up to 3-4 hours, or they feel that the morning, like they feel stiff the whole day. So that's a very important question. And a third question that I always ask my patient is, does the pain get better with exercise? All right, so if you have mechanical pain, mechanical back pain, that is what we call osteoarthritis or bone on bone or degenerative arthritis, then the pain is worse when you exercise, and usually it's going to prevent you from exercising. On the other hand, if you have an inflammatory back pain, what I have found is it's known, and that's what we are learning as a rheumatologist, is that patients will actually want to never stop working out. And so the first thing they do when they wake up, they start doing yoga, they start stretching, and so on. And that is what we call inflammatory back pain. The pain gets better with exercise, right? So it can be any sort of exercise, but like you feel like, oh my goodness, like I'm in so much pain, but the moment I exercise, I feel better. So those are like the three main questions. Is it worse in the morning? Is it worse in the morning? Is it associated with morning stiffness of more than 30 minutes? And 3, is it getting better with exercise? And then there are other clues that can help us. So what are other clues? Number 1, does it get really much better with an anti-inflammatory? So you take ibuprofen and you're like, holy cow, like this is it, I'm feeling better. Sometimes it's one anti-inflammatory rather than another one, and it's very individual, meaning that For example, if ibuprofen doesn't work for you, you can actually try Advil. If the Aleve doesn't work for you, you can try diclofenac, Celebrex, meloxicam. We have so many, like you just talk to your primary care physician. Don't give up though. Try something different. So is it really working? Is the anti-inflammatory really helping? And then the other details that can really help us is if you have any sort of symptoms. So for example, do you have psoriasis? Because that could be back pain due to psoriatic arthritis. Do you have or have you ever had eye inflammation? Because that can be due to ankylosing spondylitis, and we can see inflammation of the eye called uveitis or iridocyclitis. Iritis, sorry, it's really hard to say, so I'm just going to stick with uveitis. And it's inflammation of the uvea, of the eye, and so it causes pain, it causes blurry vision, and so on. Have you had bloody diarrhea? So where there is blood and diarrhea at the same time, because that could mean that you have an inflammatory bowel disease, and that is associated with ankylosing spondylitis. Do you have urinary urgencies where you have to pee and it's burning? Because again, that can be reactive arthritis that causes inflammatory back pain. So those are questions, some of the questions that your rheumatologist is going to ask you, but that can really help. The good news is that if you have an inflammatory back pain, we have amazing treatment. And the first treatment, the first line, is an anti-inflammatory. So you don't have to worry. You probably are already taking that. And that is, but it is very important for us to know, because we then have a plan and you don't have to live in pain. So that's like probably how I'm going to end this, is that there are really good treatments nowadays. And the goal of treatment in rheumatology is remission, and you shouldn't have any pain. So that is absolutely super important for you to realize that you shouldn't have to live with pain. So if you have a question, if you're not sure, if you feel like any of those remind you of your symptoms, then ask your primary care physician or to be directed to a rheumatologist, or if you don't need a referral, just come and see a rheumatologist. In the direct practice or concierge medicine that I offer, I don't need a referral. I will see you. And that can then, be the beginning of a new era for you where you don't have pain. All right, if this was helpful to you, I would love for you to subscribe. This is a very new channel. I realize I love teaching. I've taught in France, a medical student, resident, fellows. I also teach in the US. I was considered one of the best teachers when I was at Columbia University. So that's really something that I love. If it is helping you, either because you are a patient or maybe you know someone that has some conditions, rheumatologic conditions, or maybe you are a resident or a fellow or a medical student. Anyway, in any case, I hope this helps you, and please link, subscribe, and share, because that is how we get some more visibility, and to me, this is super important. Have a great day. Bye-bye.